29-year-old Bernard Sigei was diagnosed with tendinitis as a result of multiple tendon, nerve and vascular blunt injury on his left hand about a month ago.
Nilikuja hapa juu ya kuvamiwa njiani na wakora, wakanikata mkono. Nilikuja tarehe 20 mwezi uliopita wakati nilivamiwa na wezi kwa njiani nikielekea kazini.
His pursuit for treatment led him to Mbagathi Hospital, where a series of tests were conducted by a team of 4 doctors who concluded he was experiencing incessant joint inflammation.
We are grateful that we have a plastic surgeon here and we are offering that service and didn't have to go to another facility, maybe to queue and also to undergo a process whereby to end up in theater maybe after some few hours. Yeah, the good thing is the surgeon was present, and after reviewing the patient, he made a decision that this patient needs to go to theater for a reconstruction of the tendons, the nerves and the vascular aspect.
The extent of Bernard's inflammation was proven after he was examined with the aid of the newly installed CT scan here, which saw him admitted for reconstructive plastic surgery, which took 3 hours to perform.
And the patient is currently recuperating well. He's on follow-up visits in the outpatient clinic for the plastic and reconstructive surgery, and also undergoing occupational therapy in terms of the functionality of the hand.
Mpaka saa hii naweza kashika kitu mkono because nisingeweza shika.
The cost of treatment in the country is still a nightmare to many patients. In Bernard's case, the surgery expenses were not fully covered by the NHIF as he had to pay 300,000 Kenya shillings.
This patient was not attended to, or rather the patient delayed from getting the services. Could have ended up his hand being chopped off. And also could have ended with a disability, of course, and losing a hand is like losing 50% of your and it's a permanent disability.
According to Mbagathi Hospital CEO Dr. Alexander Irongo, the value of the high-end equipment produced by the county government and refurbishment of theatres as well as upgrading essential equipment that are critical for diagnosis have gone a long way in meeting the residents' medical needs.
Most of the patients who are going to queue at Kenyatta National Hospital be getting booked for surgeries, years, 1 year, 2 years, 3 years. We have offloaded that from Kenyatta because we are now able to do neurosurgeries, complicated orthopedic surgery procedures, plastic and reconstructive surgeries, ENT, ophthalmology, that is eye surgeries, and many others.
This comes against a backdrop of recent successful first-ever brain surgery that was performed by a team of medics led by the facility's first neurosurgeon, Dr. Tom Mboya, earlier this year.
So the patient came here unconscious, was investigated and was done then first neurosurgery very successfully. He comes for review and even visits to say hello to us.
Mbagathi has also set another milestone by conducting cementless hip surgery, also known as cementless total hip arthroplasty, that replaces a damaged hip joint with an artificial implant without the use of cement to fix the components in place.
This was a young lady who had an accident and had a massive fracture of the pelvis, and all the other procedures were not helping this girl. And they made a decision and did that complex orthopedic. Now the girl comes here, walking without crutches.
These milestones are a clear indication of the possibilities that lie in the health sector, even though much more investment is needed in public facilities to meet the health demands of thousands of Kenyans.
Remember, even during COVID, this was the National Referral Center for COVID. And if you walk around, you also see a very big tent. We are always ready for choleras and the others. But the most important aspect or part of Mbagathi is the transformation that it has gone to be a comprehensive facility for clinical services. Yeah, because also the demand for services, the demand is very high, so we must strive.
Robbie Omondi, K24, Health Beat.